getting rid of that makes a healthy democracy. So you've talked on your website and talked about here your healthcare plan. How you described it. I think you said single payer, Medicare for all style healthcare plan. What are the benefits to individuals of what you would propose, and what are the social benefits, and is there room even within that still for, let's say, private insurance? Because I know some fear if we go to single payer, then there will be no private insurance. Is there room for both? So what is the benefit of your plan?
In order for us to experience health, the fullness of human life, we need to be in a healthy community. So health, or the experience of health, or being healthy, cannot be done alone. It's done in communities that have, for example, well-managed determinants, social determinants of health. And no one gets sick alone. Whenever anyone falls ill, there's a family that's affected, a whole network of associations that are affected, your coworkers are affected. Certainly we can feel this during our COVID pandemic. In a family, a child becomes ill, the family's life stops. So with those two notions that we can only remain healthy as a healthy community, and we never are sick alone, we can recognize that the healthcare services that we want to make available for ourselves are really very public. They're not just individual. They're not commodities. What we want as a community, someone stated to me, is we want quality healthcare services when we perceive their need without a hassle. So getting to your question about how does this work for us as an individual, with our current system, it's very individualized. If you can pay for it, we'll sell you the goods. If you can't pay for it, sorry, it's too bad. We've commoditized this service. And so we need to move completely away from that frame of thinking about what we're buying and selling. Under the current frame, as long as you have resources or you can get some kind of insurance plan to give you resources, then you feel a certain amount of security that you're going to have what you need. But it's short range because it's that individualized approach. So a single payer system is paid through public funding. And currently, under our current system, this really shocked me when I learned it 2 years ago, about 2/3 of the expenditures in our country, $3.7 trillion, comes from public sources already. That would be federal funds, state funds, local funds, the VA system. All of these together are publicly financed, coming out of tax bases already. We've already, 2/3 of our current expenditures are by tax base. What we have is this little piece in the middle that is privately financed that we all experience. It's so threatening to us because it has exorbitant copays, or it has deductibles, or it has all kinds of caps on it that we keep trying to push back all the time. It's such a inefficient system, simply to allow the insurance entities to get in the middle of it and keep finding ways to make money in it. And we say, you're just not helping. Get out. That's the final solution. You're not helping us be healthier. You're orienting our struggle to provide good services into an individualized commodity that you can somehow make profits off of. We need you to leave. And so I don't care if insurance payers want to provide some management of risk for other things, but for our essential need of providing care for ourselves as an essential human need, they're not helping us do the job. So my preference is that, like under the Jayapal bill, they're not included in the plan.
Okay.